So I'm Dr. Novotny. I'm an otolaryngologist, which is an ear, nose, and throat surgeon here in Columbus. And I see a lot of patients with sleep apnea, so we have a lot of experience at our clinic with sleep apnea. Just to start with, we'll talk about some of the symptoms. And quite often in the office, if you come in as a patient, we can have a pretty good idea if you have sleep apnea just by our first visit, but then we send people for sleep studies. But some of the symptoms would be if you're excessively tired during the day, like falling asleep at various times. We have a questionnaire that we go through, and you get a score on the questionnaire. So if you're excessively tired during the day, that's one thing.
Yes.
If you snore loudly, and one of the questions, if you snore loud enough to be heard through a closed door or from another room. Sometimes there's a bed partner or a family member that has observed the apnea. If you wake up gasping or choking, gasping for air, that's another strong symptom. If you wake up with a dry mouth or a sore throat in the morning, that can be a symptom. Also, a morning headache would suggest that you're not getting enough sleep. And quite often it goes along with hypertension, although it's not at all the only cause, but they're quite often seen together. What causes sleep apnea is your airway obstructing when you get into a deep sleep. So when you get into the deep sleep, the throat muscles start to relax and they can sometimes collapse, and it gets so tight that you start to snore, and then if it completely collapses, you can't breathe at all. And so often the person that's observing you sleep can see you making respiratory efforts, but without actually passing any air. And then you can your brain says, oh, I'm not getting enough oxygen, and suddenly it starts to wake you up, and so you'll gasp for air and you take a big breath in, and then the cycle starts all over again. Then it does this many times during the night. And I've had patients, well, almost everybody does a little bit sometimes. So once in a while, it's not a big problem. It's when it does it many times and your oxygen drifts lower and lower during the night. And usually the patient is unaware of it. Although I've had many people that said, oh, I wake up gasping for air. I wake up choking in the night. But I've had people that will stop breathing hundreds and hundreds of times during the night. So there's a gradient from just a little bit to really severe, and they can measure that all on a sleep study too. So some of the risk factors, well, if you're overweight, that is one, and that just adds excess fat into your throat, and even in the tongue can have additional fat, and it just constricts your airway more. Some people are kind of born with a narrow airway, and especially if your chin is kind of one of those weak chins that is kind of way back, and so then it allows your tongue to fall back more, whereas people with a pretty strong chin or kind of an underbite are a little less likely to have sleep apnea. If you have hypertension or high blood pressure, if your nose tends to be congested, sometimes allergies or a deviated septum can contribute to that. Smokers are more likely to have sleep apnea. Also, if you're diabetic, male, or have a family history of sleep apnea, and also asthmatics. So there's a number of risk factors, but probably the biggest one is being overweight. And I tell people that it gets worse the older you get and the more weight you gain. So if you have a young person that just has a little bit of it, I warn them right there in the office. I say, you know, you don't have it right now enough to count, but you give yourself 10 years and 50 pounds and it'll make a big difference. So you can't change your age, but if you can keep that weight off, it's a huge help. So then complications of sleep apnea. Obviously, if you're falling asleep at school or at work, that's not a good thing. And I've had people that literally fell asleep on the job and they're working with heavy machinery. And so there's some risk of being injured in those machines. Falling asleep at the wheel driving, one of the things we think about, you know, truck drivers in particular, where they don't have time to get a lot of exercise and they're driving for hours on end, and it can be kind of make it real easy to fall asleep at the wheel. Then if you have heart problems, this will make them worse and can certainly contribute to it. during your sleep, your oxygen, if it tends to be really low, you're at risk for heart attack. Atrial fibrillation, which a lot of people have, an irregular heartbeat, is another complication, and of course hypertension. And if you stop and think about it, when you stop breathing multiple times in the night and your oxygen is low, it's a strain on your heart. And depending on how severe your sleep apnea is, it can be a really bad strain on your heart. And if it's just a little bit sometimes, then it's not so much of a strain. So again, there's varying degrees of it. Complications with medicine, drinking alcohol before bedtime, or taking a sedative at bedtime. It kind of sedates your brain. Both of those things do, sleeping pills. And then you don't wake up as easily when your oxygen gets low. And so sometimes people that are on sedatives or that drink alcohol before they go to bed, their oxygen drops even lower than it would have. And so it's even more of a strain. So complications with surgery, I mean, I see this in the operating room fairly often, and the anesthesia people can really see it. When you start to put somebody to sleep, their airway will obstruct when they give them those anesthetics. And so sometimes it can be difficult to put the breathing tube in because of the thickness of the neck and the crowding down in the throat. And so all of those things can be a problem. Or if you do surgery with sedation, think things like wisdom teeth extraction. Now that's usually in younger people that maybe don't have sleep apnea, but where they give that kind of a sedative that they call twilight anesthesia. And I use that sometimes for some of the things I do, but you sedate a person enough, then they can obstruct their airway. So that can be a problem. It adds to glaucoma. That's something that isn't often thought about. And then if you have a sleep partner, a spouse, or even any other family members, or I see this in people that go camping, that the people that go camping with can't sleep, and so they will give you a hard time, or people that you travel with will sometimes make the patient with sleep apnea get their own room rather than sharing rooms. And then if you're sleep deprived, it contributes to trouble with memory because you're just sleepy and it's hard to pay attention and to remember things. So there's a lot of things that can go into this. And I know in my own practice, I have had people that had sleep apnea, and I've had many of them walk out of the room and saying, oh, I know what I need to do, I'll lose weight, and then they don't. And I have seen their obituaries in the newspapers dying in their sleep of a heart attack. And I think that is because they had sleep apnea, or at least it was a big contributing factor. And so I don't like to see people walk out and say, oh, I know I should lose weight and I will, but then they don't, because it's hard to do. It is very hard to lose that weight. So the definitive test for sleep apnea is to go either have a sleep study in the lab, or now we're doing more and more home sleep studies, which I think Nate might talk a little bit about. I mean, the in-lab study was kind of the gold standard for a long time, got really good studies, and you could see exactly what was going on. The home studies have gotten better and better, and they have been very useful in the last few years that we can send them home, we can get them done a little quicker, and the home studies are very good now. You know, when I first started practice, I didn't like the home studies because they just weren't good enough, but now they are much better than they used to be. And so we're seeing a lot of home studies, and I'm totally okay with the home studies. Then once you get your sleep study done, you think, well, what can I do about it? Well, the CPAP, that's also the gold standard for treatment of obstructive sleep apnea. If you know anything about people with sleep apnea, and the CPAP, it's a mask that you wear at night that fits over your nose and or mouth, and it gives you positive pressure, and it helps force that airway open so you don't stop breathing in your sleep. And it really does work. It works very well. Some patients have difficulty tolerating it because if you feel kind of claustrophobic with the mask on, or a lot of times people just don't want to wear it for any number of reasons. The CPAP has gotten better and better over the years. I know when it first came out, one of the conferences I went to, they showed a photograph of the original sleep machines. They were very loud and cumbersome. They were big, complicated machines, and they are so much better now than they used to be, that if you just give it a chance, they work well for most people, not for everybody. But that's one of the things that you can do tomorrow and get started with treatment of it. Other things like weight loss, obviously that will help. It will always help at least some. And some depends on the person's anatomy. So if you have a really weak chin, well, you can lose all the weight you want, but that weak chin sometimes is still an ongoing problem. So weight loss, I encourage that in anybody that's overweight, but it is hard to do, and you can't just do that tomorrow. So it will take months, if not years, to get that weight under control, but it's certainly worth doing. And even if you can only lose a few pounds, 5, 10, 20 pounds, it'll help. You know, there are patients I have that need to lose 100 pounds. And so that's difficult. But I have had people lose 100 pounds because they didn't want to be tied to that CPAP forever. And it can work, but it's hard to do. It's really hard to do. So I don't just count on them losing weight and say, oh, well, you're going to be cured, just lose the weight. We need to get you on the CPAP first and then get working on the weight loss. Now, also this, avoid the alcohol and sedatives. So many people think, oh, that glass of wine before I go to bed, it helps me get to sleep. But what they don't realize, yeah, it might help them get to sleep, that alcohol, it messes up your sleep cycles through the night, no matter what. Even if you don't have sleep apnea, it messes with your sleep cycles. So alcohol right before bed is not a good idea. So I discourage that. And also sleep like sedatives that you take, it also, same story. It relaxes you too much. That and alcohol, it relaxes you too much. Your throat collapses more, and it's harder to wake up because it's a sedating thing, and your brain just doesn't wake up as fast as it should. And then, you know, I'm a surgeon, and so we do surgery for sleep apnea actually fairly often. Nasal surgery, if your nose is really crooked or really congested, nasal polyps, those kind of things, we can do some, but I never tell a person we can just cure all of this just with nasal surgery. It is much more complicated than that. And off the top of my head, on average, I would say you can get maybe 30% improvement with nasal surgery if your nose is bad. There are people that nose really isn't that bad, and then the nasal surgery certainly wouldn't help that much. Also, there's surgery on the palate. Some people have huge tonsils that are obstructing their airway and a long, thick uvula, floppy palate. So there's palate surgery that we do that usually includes taking out the tonsils. Often it can include removing the uvula and even trimming back part of the palate. And so there's a number of different things that go with that. There's also surgery, what we call coblation on the tongue, where I have a little probe that is radio frequency ablation that can shrink the tongue some. I tend to be pretty conservative on the tongue. I know there are surgeons around the country that will actually take fairly big wedges out of this kind of back center of your tongue. I guess I'm not quite brave enough to do that because the tongue is so important for language, for speech, and swallowing. So maybe if I did exclusively sleep apnea, I might go to that. But I think this coblation in the tongue, it helps some. It shrinks the tongue some. And for a person that's willing to do that, I can do it when I do the nasal surgery, and I can do again a little more when we do palate surgery for people with really bad sleep apnea. One of the problems with it is insurance doesn't always cover it. And so some of that depends on the insurance company. And if the insurance doesn't cover it, if they're having this other surgery, insurance will cover it if you've got a bad enough sleep study. So sometimes the cost isn't all that much more, and people are willing to pay for that on their own just to help their sleep apnea. So those are some surgical options. And now there's another brand new one that we're just getting ready to start here in Columbus. That is it's an electrical stimulation of your tongue. Now it's a little bit more complicated than you can imagine. It's an implant that goes implanted into your chest, and you thread a little probe up, a little electrode up into the neck to the nerve that goes to the tongue, and you kind of attach it to that nerve, and it can sense, because it's down in the chest, it can sense when you're struggling to breathe, and it will trigger that little nerve to your tongue. Don't think it's a shock. It's kind of like a shock, but I don't think the patient doesn't feel it as a shock, but they can feel, and it kind of thrust their tongue forward a little bit, and it helps open up the airway. The reports on it have been pretty good, but again, it's fairly new. And we have another doctor, Dr. Henderson, that comes from Colorado that has some experience with it. So we'll be starting to do that here in Columbus. You know, you need to have kind of gone through the sleep study and been tested to qualify for that. So, and if obesity is a large part of the problem, then it's not, to do this tongue stimulation really isn't a very good option for that. So anyway, so there's several different surgical options. And of course, for the person that is, there are some people that are just on death's doorstep every single night. Their oxygen goes so low for so long of a time that really a definitive surgical cure would be a tracheotomy, where you put a hole in the neck and they have a trach tube in, and it will cure your sleep apnea immediately. And you wear it plugged all day long, and you can take it out at bedtime. And so you've got a complete open airway all night long, and you are cured. But most people don't want a tracheotomy. But I have had a few people with tracheotomies for sleep apnea, and not very many, because most people don't want that. But if you are 5'2" and you weigh 350 pounds, that might be your best option to get that cured. And then you could go ahead and lose the weight, and you could work on the CPAP, and you can do these other things. And you could, if you could get the weight off, eventually get that trach taken out. But there are people literally ready to die because their sleep apnea is so bad, and their neck is so thick that the CPAP isn't working. And so there are rare candidates for that, but that's yet another surgical option. So I think I'll let Nate take from here. There's of course other sleep disorders, things like insomnia and different things. So this isn't alone. And I'm talking about obstructive sleep apnea. There's also central sleep apnea, that you just stop breathing and you don't really know why. It's like your brain doesn't make you breathe, and it's not obstructed, but so that's another whole different thing. And we don't see an awful lot of that, but I think I'll let Nate take it from here.
Okay. Hello, everybody. My name is Nate Fuerhoff. I'm the Director of Respiratory Care in the sleep lab here. I actually moved here in 2005 to help start the sleep lab here. So I've scored every single sleep study we've done, probably 4,000 to 5,000 of them. Not quite sure, lost count. So I'm going to talk a little bit more about just kind of sleep in general, since a lot of people just don't know very much about sleep. Talk about some good sleep habits, what poor sleep can do to you, and then a couple of the other sleep disorders that Dr. Novotny had mentioned, such as insomnia and restless leg syndrome. So I always like to start out just with kind of the basic, dictionary definition of sleep. It's a naturally occurring state of mind characterized by altered consciousness, relatively inhibited sensory activity, inhibition of nearly all voluntary muscles, and reduced interactions with surroundings. So in a nutshell, basically just means you're not conscious and you're not really being affected by your outside surroundings. And that's kind of basically what sleep is. Now, why do we sleep? To be honest, we really don't know. There's about 8 to 10 different theories for it. None of them are proven, probably never will be. But it's most likely a combination of all of the theories kind of put together. But if sleep weren't something that was essential, we'd expect to find, an animal species that does not sleep, which we haven't been able to find. Animals that don't need recovery sleep after staying awake longer than usual, or animals that suffer no serious consequences as a result of lack of sleep. But we haven't found any of that yet. So obviously sleep is essential, for us to survive. Not all animals sleep the way that we do. Dolphins, for instance, they turn off one half of their brain and sleep and keep the other half awake. But all animals sleep in one form or another. Just kind of some interesting sleep facts. The longest scientifically recorded period that somebody stayed awake was 11 days. I stayed awake for about 48 hours, and that seemed pretty outrageous. I can only imagine 11 days. And I've heard some of the stories from these experiments they did on people that keep them up for 8 or 9 days, and it usually did not turn out very well for the subjects. All people dream. whether they admit it or not. I guess instead of admit, I should say remember it or not, but all people do dream. And a lot of people, they hear, that they don't know much about the stages of sleep, but almost everybody's heard of REM sleep, which is a rapid eye movement sleep. And most people assume that all dreaming occurs during that stage, which really isn't true. People can dream in any stage of sleep, not just REM. Memory recollection, it's always very interesting. I know this from experience. 5 minutes after waking, your memory recollection decreases 5 to 10%, compared to 65 to 70%, maybe 10 to 15 minutes after. If somebody wakes up from a dream, you ask them immediately, what did you dream about? They can remember it. 10 to 15 minutes later, they tend to not be able to remember very much. 37% of adults say they are so tired during the day that it interferes with their daily activities. 37% is a very large amount. So some common sleep disorders, Dr. Novotny kind of went through and explained obstructive sleep apnea very well. So I'm going to kind of skip over that one, and can always ask questions after we're done about obstructive sleep apnea. I'm going to go to insomnia and then restless leg syndrome. Those are kind of the two next most common sleep disorders that we find. Insomnia is a sleep disorder that involves repeated difficulty getting to sleep. And once they're asleep, they have a hard time maintaining that sleep for an adequate amount of time, even though they have the opportunity to sleep. It can be acute, meaning it's just something that happens for a short period of time, less than 3 months. A lot of times acute insomnia can be caused by, big life changes, deaths in the family, stressful situations, things like that. Or chronic. Chronic means that you have these symptoms 3 times a week for a minimum of at least 3 months. So it's not caused by anything that you can resolve on your own. And it's estimated that about 10 to 30% of adults suffer some sort of insomnia, but those rates vary between different racial, ethnic groups, things like that. Insomnia is more common in older adults and also in women. And it's much more common for night shift workers or people that travel for work due to the jet lag effect. Things that can cause insomnia, unrelated health issues, bladder or prostate conditions, keep you up all night, going to the bathroom, things like that. Pregnancy is a big cause of insomnia. Chronic pain in the shoulders, joints, hips, stuff like that can keep you, not let you sleep well. Restless leg syndrome is what I'm going to talk about next, can cause insomnia. Also consumption of substances that affect sleep, such as alcohol, like Dr. Novotny had mentioned, nicotine, caffeine, some diet pills and cold remedies can also make it difficult to sleep. Also behavioral and mental health issues. Insomnia is a major symptom of depression. A lot of people that have depression also suffer from insomnia. And unfortunately, the two a lot of times kind of feed off each other, just like with anxiety. Anxiety and insomnia feed off each other as well, because the person kind of lays there and they know they're not going to sleep, and that anxiety builds and builds and builds. It makes it even harder for them to go to sleep. Other mental health disorders, such as bipolar disorder. A lot of people with bipolar disorder also suffer insomnia, and a lot of times just very poor sleep habits. Unfortunately, we have a lot of bad sleep habits in society these days. We live in a society that's all about getting stuff done all the time, and that's the main focus, where sleep should be a much bigger focus, and we really kind of take it for granted or don't place the value on it that we should. Symptoms of insomnia, kind of like I mentioned just in the definition of it, difficulty falling asleep and then staying asleep, waking up earlier than planned, or not feeling tired at bedtime, daytime fatigue, memory and concentration issues, mood disturbances and irritability, hyperactivity and aggression. Obviously, if you're not getting enough sleep, you're not going to be in a very good mood. People tend to be very aggressive. They can be hyperactive, and irritable. So treating insomnia, for many years, treating insomnia was medication. That was kind of the first mainline treatment, is just try to give you some medication to help you go to sleep. But now kind of the first line therapy is what we call cognitive behavioral therapy. It is the first line therapy now because it doesn't carry the same risks that are associated with sleep medications. It focuses most on sleep education and hygiene, stimulus control, cutting back caffeine intake, that kind of stuff, relaxation methods, yoga, meditation, things like that. And then sleep restriction and compression, where we actually try to tell you when you should go to sleep, when you should wake up, and not let you operate outside of those ranges to try to get your body trained to sleep and wake up at those times. It does need to be carried out by usually a trained licensed psychologist. The main focus, like I said, is correcting that person's bad habits, but it also addresses the anxiety and the negative thoughts that can come with insomnia. Like I said, people with insomnia, they do get very anxious just for the very fact that they can't sleep. So that tries to address that as well. Medications are still also used to treat insomnia. You see a lot of commercials for them. Some of the common ones, Ambien, Lunesta, things like that. Although they have, minimal side effects, obviously with any medication, there's going to be the chance for some side effects, which you don't have with the cognitive behavioral therapy. And they're really not recommended for long-term use. Unfortunately, a lot of people, they don't understand that those really aren't meant to take for years and years and years, and they do start to lose their effectiveness. So that's also something to consider. So I'm going to kind of move on to restless leg syndrome. This is something we see a lot of in the sleep lab as well. It's really a condition where the person just feels like they have to move their legs all the time, and they don't really have a good answer or a reason as to why they need to move their legs. They think it's related to an imbalance of dopamine at night. So some of the treatments, they might have you take a dopamine supplement, things like that. Most commonly occurs at night while reclined or laying down. A lot of my patients in the sleep lab, when they have, one of these attacks from their restless leg syndrome, they immediately call us into the bedroom because they want to get up and walk around. That laying down kind of seems to trigger it, especially late at night. Symptoms can include pain in the leg, sleep deprivation from, just having to move your legs all the time. I recall a case right when I kind of moved here. A sleep study is usually about 7 hours long. I had to go in the patient's room every 15 minutes for the entire night just because they had to move their legs and get up. Obviously, they did not get very much sleep in between that. Tingling or burning sensations in the legs, Charley horses, restlessness. A lot of people describe it kind of like a line of ants kind of crawling around on your calf muscle, things like that. Bugs under the sheets kind of thing like that. So common treatments, just kind of self-care, physical exercise. That kind of seems to help a lot. Relaxation techniques, no smoking, caffeine, all of that has been shown to help improve. Massage therapy has also been shown to improve restless leg syndrome. And like I mentioned before, medications. There are prescription medications, but there are just kind of over-the-counter dopamine promoters and iron supplements as well. A lot of times you find people with restless leg syndrome, they tend to have low iron levels, which is why the iron supplements can sometimes help. So I was kind of talk about some effects of poor sleep. Like I mentioned before, unfortunately, people just don't put the value on sleep that they really should. And I'm just as guilty of this as everybody else. I have a lot of stuff that I need to get done. There's only so many hours in the day. And unfortunately, when you think about things that are necessary for us to function correctly, food, water, all that stuff, sleep is usually the one that gets overlooked the most. So Poor quality of sleep, it can have long-term and short-term consequences. Short-term, decreased performance at work and alertness. Studies have shown that reducing sleep by just an hour and a half can decrease your alertness by as much as 32%. Decreased ability to think and process information. Obviously, if you're very tired, you're just not a lot of times thinking right, and you have a difficulty processing the information you're bringing in. Increased moodiness and aggressiveness can lead to relationship problems, problems at work. Obviously, everybody listening has been tired before. You tend to be a little bit more grumpy when you're tired. So long-term though, high blood pressure, heart attacks, strokes, people suffering from long-term sleep deprivation are almost 50% more likely to develop heart disease. Okay. And long-term sleep deprivation would be considered less than 5 hours of sleep. That's kind of the general rule that they go by, is 5 hours. Psychiatric issues, like we already talked about a lot, depression and anxiety. You also see an increase in impulsive behaviors, paranoia, and even suicidal thoughts. Another long-term consequence, obesity. People who average fewer hours of sleep are 50% higher risk for obesity. That obesity then carries all of its own health issues. And like Dr. Novotny had mentioned, sleep apnea, as well as a number of other things. That obesity, so your appetite a lot of times is actually controlled by hormones. And people that are tired, say from insomnia or even sleep apnea, when your body is tired, it increases a hormone called ghrelin. And ghrelin is a hormone that tells you you're hungry, but it also decreases a hormone called leptin, which is one that tells you you're full. So people that are tired or have sleep apnea, they tend to eat more. It's one of the challenges for patients with sleep apnea at losing the weight like they say they're going to. They have a really hard time losing it just because of that tiredness causing them to eat more, and they can't get that weight off. And also that ghrelin, it makes you really crave the sweet, salty, starchy foods, all the stuff that tastes really good that really is not very good for you. Decreased immune response. Your immune system produces a lot of its protective, infection-fighting things like cytokines at night while you're asleep, and those assist in protecting you from viruses, bacteria. People with sleep apnea, I know, are about 33% more likely to catch common colds, sinus infections, sore throats, things like that. And dementia, also a long-term consequence. Long-term sleep deprivation shows a 33% increase in the chances for dementia. So lots and lots of long-term and both short-term consequences of not getting enough sleep. Kind of questions I get a lot is, how can I sleep better at night? And I don't expect everybody to be able to follow all of these. I know I don't. I try to, but like I said, in today's society, it's just very hard. Kind of the biggest one I always tell people is keep a regular sleep schedule. Always go to bed at the same time, always get up at the same time. Weekends, sleeping in 3 hours longer than during the week when you have to get up for work. It sounds like a great idea because you get to pick up on some sleep, but your body is used to waking up at that certain time. You're sleeping past what it wants to do, and you're basically kind of fighting your body. If you can go to bed at the same time and wake up at the same time, your body gets trained into that routine. It makes it very easy to fall asleep. I used to work a rotating schedule where I would work nights in the sleep lab, then work some days, and it's very hard on the body. With my schedule now, I really go to bed every night at 11 o'clock, and I usually fall asleep within about 5 to 10 minutes. And I can probably about 75% of the time wake up about 5:45 in the morning without an alarm. Obviously I set it just in case, so I don't get in trouble for being late for work, but about 75% of the time, I really don't even need that alarm just because my body is trained to get up at that time. Naturally regulate your sleep-wake cycle. This is something that's very important for people that work night shift. If you get off that night shift, the sun's up in the morning, you don't want to just walk out into that bright sunlight, have that activating your brain thinking you need to be awake. Wear sunglasses when you get off work in the morning, things like that. Same thing at night when you're going to bed. You know, try not to have lights shining all around. You know, at my home, before we go to bed for about a half hour, we kind of turn and dim down all the lights. Just kind of starts to activate that brain to let it know it's time to probably start getting ready to go to sleep. Create a relaxing bedroom, you know, whether that means ambient noise machines, cooler temperature. People tend to sleep with the temperature, they sleep better with the temperature cooler at about 67 to 68 degrees. Make sure you have a good mattress, all of that kind of stuff. Eat and exercise regularly. But you don't want to exercise a bunch right before you go to bed. A lot of people think that's a good idea because they think it's going to wear them out and help them go to sleep. But really all it does, it gets your blood pressure up, it gets your heart rate up, and it just makes it harder for that body to just relax itself. And then, you know, do your best to keep anxiety and stress in check. Obviously, a lot of times that's easier said than done, but, you know, try to do a relaxing activity before you go to bed, you know, whether that be reading, crossword puzzle, you know, any kind of puzzles like that. They make a lot of apps that you can get now for your phone that, you know, have relaxing music or stories, you know, things like that to try to help you go to sleep. And that's kind of the one thing you hear a lot about with people, especially with insomnia. They want to go to sleep, but the brain just won't stop talking to itself. So, and that's it. Open for any questions.
What is normal as far as sleeping for a 34-year-old male who is overweight but started working out 3 times a week and is around 6 foot tall?
If you're talking average hours, I mean, it does vary, you know, a lot individual. I always tell people 6.5 to 7.5 hours is a really good time. You see a bell curve when you're talking about sleep time. And obviously I can't draw a bell curve for you right now, but people think for some reason that getting a lot more sleep is going to actually be healthy for them, where actually it isn't. Once you start getting past that 8 to 8.5 hour range, it actually can start causing health issues. So you have kind of a bell curve where about 6.5 to 7.5 hours is about the correct amount.
One thing I might add to that, if you need an alarm every day, just like Nate mentioned, and you have to have an alarm to get up, you're probably not getting enough sleep. So you should back up your bedtime so that you don't need an alarm. And that's what we see that with children too. Children tend to be sleep deprived, and they think some of the hyperactivity in kids, may be just sleep deprivation. So if your child needs an alarm, if you have to wake them up in the morning, you should be putting them to bed earlier. So that's one of the things you can kind of think as a hallmark, is if I need an alarm every day, I'm not going to bed early enough. So back it up. And you can't just switch from, like he mentioned, 11 to 9. You can't make that switch if you're used to staying up till 11. So you got to go gradually. So you might just go for 10:30 or 10:45 and do that for a while and see if you still need the alarm. And if you can, maybe have to back it up a little bit more. So it is different for different people. And so it's a hard one to give an absolute number to. But like he mentioned, if you can try to go to bed at about the same time every night and about the same time, get up at the same time every day, that would be wonderful. But our life doesn't always allow us to do that. But you want to aim for that the best you can.
Yeah. And the amount of sleep you do need, it does change greatly over the course of a person's lifetime. As we get older, we tend to sleep less. We might sleep more often, but in the total time, we do tend to sleep a little bit less. So that's something to remember as well.
Is it normal to be sleepy all day, and why do our eyes water when sleepy?
It's not normal to be sleepy all day. That I can answer pretty definitively. you know, the eyes watery during the day,
Or at night?
or at night.
Was the
It just
question,
says, is it normal to be sleepy all day? And then why do eyes water when sleepy?
when you're sleepy,
Not
not,
sleepy.
I guess I don't know.
Never heard that.
It is not normal to be tired all day, though. It would suggest that you're sleep deprived if you're tired all day. You know, and another thing about getting good sleep, it's quite often for people to use some caffeine in the mornings, you know, their cup of coffee or whatever. And I don't really have much trouble with that, but people that take in a lot of caffeine throughout the day, can overstimulate you, and especially if you're taking it in later in the day, it can keep you awake at night. So especially someone that lays awake and has trouble with insomnia, they should cut off that caffeine earlier and earlier, really limit that caffeine even in the mid-afternoon, but for sure in the evening.
Just for context, I know a black cup of coffee, that caffeine can still be in your system for about 8 to 10 hours after
Right.
you've drinking that.
Right.
Drink that 1 cup of coffee. So I always tell people about 2 in the afternoon at the latest.
And I think sugar late at night also can be stimulating to people to keep them awake sometimes. So, you know, if you have trouble falling asleep, you might really lay there while you're laying there awake thinking, what did I eat since noon? And just try to keep track of that a little bit. And you'll start to discover some common denominators for the nights you couldn't get to sleep and nights that you could.
What about large tonsils as a risk factor for sleep apnea?
Well, that is a risk factor. And there are some people that have really large tonsils, and it is a big risk factor, and we can make a big improvement by taking them out. So I don't usually take tonsils out. We're talking adults here. Children is a different story, but for sleep apnea, unless we have a sleep study. Because just because they're large doesn't mean they have to be removed. But if they're causing problems because they're large, like sleep apnea, then we take them out. But the sleep study, insurance a lot of time hinges on the sleep study. So if your sleep study doesn't show any trouble with your sleep, even if your tonsils are large, you don't necessarily have to have them out.
Are CPAP machines noisy?
The new ones aren't.
No, I mean, I've seen some of the old original ones, like you mentioned
They
too.
were bad.
A CPAP machine is basically just an air compressor. And 20 to 25 years ago, they sounded like an air compressor that you would find in your garage. That's kind of what they were like. But no, room fan, I would say they're quieter than a room fan for sure.
Yeah, and some of them now, you can get small to travel with. I mean, I know people that go hiking and take them with them hiking and camping and traveling. They take them on the airplane and that have them with them, because once you get used to it, you realize how much they really work and they really help. So.
Can weight loss cure sleep apnea?
It really can for some people, not for everybody. So if you've got a person with a terribly deviated septum and large tonsils and a thick uvula, you can lose weight and improve it, but sometimes it's a combination of things, the weight loss and surgery. But there are people who just flat out, if they lose weight, they can cure it just by losing weight. But it depends on their anatomy of their airway.
How much do sleep studies cost on average for lab?
So I'm going to go through kind of all of them. So in-home sleep study, which, Dr. Novotny mentioned, which are much, much better than they were when they originally came out. They charge $500 to $550 for an in-home sleep study. And most insurance companies are very easy about approving those. They do get billed to insurance. And we usually have no issue with those. The in-lab sleep studies, they do get more expensive. They're somewhere around the $3,000 to $4,000 range. Each test has its advantages, disadvantages. The home sleep study, obviously the biggest advantages are the cost and also just the comfort level of it. We're not recording near as much stuff. You don't have to wear near as many monitors, and you just get to do it at home in your own environment. There's not that anxiety level that comes with actually staying at the lab. This in-lab sleep study, we're going to be monitoring a lot more things, which means we have to have you wear a lot more electrodes, things like that, so we can monitor. We get a little bit more information from that. The home sleep study is really kind of focused or geared toward, I would say, people that don't have near as many other health factors, don't have any significant cardiac problems, things like that. That's kind of really what that test is focused for.
Are they covered by insurance, and how long are they?
So yeah, they are covered by insurance. Like I said, certain insurances will only approve the in-lab sleep study versus, or the in-home sleep study versus the in-lab sleep study. As far as how long one lasts, I'm assuming they're meaning how long they have to stay. It is an overnight sleep study. They are usually here from either 8 or 9 in the morning till about 6:30, or 8, 9 at night till 6:30 in the morning.
I was diagnosed with obstructive sleep apnea in my 30s and was on a CPAP for years. I lost over 100 pounds and am no longer on my CPAP.
Congratulations.
Yeah.
That's great.
Yeah. I wish every story was kind of like that one. So unfortunately, like Dr. Novotny said, a lot of people just don't, if I have a guy come in and he's 190 pounds, but he has severe sleep apnea, he can't lose 100 pounds. I mean, that's not going to fix that case. But, in certain cases, the weight loss can just do it by itself.
What level of oxygen should a patient consider a dangerous level?
Go ahead.
Well, I mean, we always consider above 90 as normal. I mean, anytime that number starts going below 90, that's when that brain starts to get triggered that, something isn't working quite right. I'm really just not getting enough. Obviously, if it's 88, 89, 87 for short periods of time, that's not real dangerous. But, I've seen people in the lab in the 40s.
Yeah, the sleep studies, when they're complete and there's a report, it will tell us what percentage of the night they spent above 90%, or what percentage in the 80% range, what was their lowest number. And like Nate said, we do see people in the 40s and 50s sometimes. That's really bad, but if you can spend the majority of your time, 90% and above, those occasional lapses a little lower isn't seen as so bad. But if they spend 20% of the night in the 70s, that's bad, so it's kind of a gradient.
Yeah, I've seen you wake them up in the middle of the night and you walk in and their lips are kind of purple just from lack of oxygen. So sleep apnea in itself essentially is choking. So I mean,
just holding your breath.
Does the need to sleep on the stomach with head on hands indicate sleep apnea? Well,
it's easier to sleep any position other than your back. And so it might, because laying flat on your back usually is the worst position in terms of sleep apnea, because your palate falls back, your tongue falls back. And so that's when most people obstruct easier. So some patients, they have just really mild sleep apnea, and we just instruct them to try to sleep on their side or their stomach, and your palate doesn't fall back and your tongue doesn't fall back, and it will help sleep apnea.
A lot of patients with sleep apnea, they just instinctively sleep on their sides, really without even knowing it, just because your body and your brain has learned after a little while, hey, I just can't breathe very well on my back. So I'll just do it without even really knowing sometimes.
And it sounded, when I initially heard this, kind of hokey, but to try to train somebody to sleep on their back, to take some tennis balls or baseballs and put them in a sock and pin it to the back of your nightshirt, so that during the night, if you roll over onto your back, you can't stay there because it's uncomfortable. And so, and again, I seemed kind of hokey at first, but it does work. And, so I still tell people to do that once in a while.
I had a person in Las Vegas. This gentleman had sleep apnea. His wife took one of her old bras and sewed softballs into the cups, and she made him wear the bra on backwards all night with the cups in the back so he wouldn't sleep on his back. So not endorsing that therapy by any means,
but it could work. I mean, it forces you to not sleep on your back.
Does frequent awakening, where the individual physically arises, will eat, then fall back asleep, part of sleep apnea?
I guess it kind of depends.
It can be. Yeah. It's not always, but it can be.
If they're if they're doing it without remembering it, then that's a whole different subset of a sleep disorder.
Sleepwalking.
That's more of a REM behavior disorder.
Is sleep apnea caused by certain childhood vaccines?
I have never heard that or seen any study that would
No.
suggest that.
Can restless leg syndrome cause paralysis?
I have not
never
heard that
heard that.
either. No.
What are the worst effects of restless leg syndrome?
You know, I would say that person I had mentioned before that did that sleep study that had to get up 15 minutes, every 15 minutes for the entire night. You know, as far as like dangerous, life-threatening, you know, restless leg syndrome isn't going to cause anything like that. But, you know, it does cause a lot of other issues with getting enough sleep, getting high quality sleep. And like I said, that can lead into other issues.
Now, a person needs to get into a deep stage of sleep for long enough to really get your brain to rest and recover. So when you wake up every 15 minutes, you cannot possibly get that kind of recovery with your sleep.
A lot of people don't realize how much actually, you know, sleep is not something you do at night just because it's dark out and there's nothing on TV and you just lay there. A lot of stuff happens at night while you're asleep that you don't know. See a lot of, you know, men with sleep apnea have low testosterone levels. A lot of the body's testosterone is produced at night while you're asleep. And people that can get that deeper sleep, you know, we see those decreased testosterone levels.
And, you know, I've been to a number of sleep courses, and one takeaway from one of the meetings that I went to was a book that they recommended called Why We Sleep. And I went off and got it, and I really learned a lot, even though I feel like I know an awful lot about sleep apnea and sleep disorders. But there's a book called Why We Sleep by a PhD. I think he's at Stanford, but I'm not sure. A Dr. Matthew Walker. And I think he's written more than one book, but I would encourage anybody that's having trouble sleeping, worried about sleep apnea or insomnia or any of those things, to get that and read it. It's interesting and you'll learn an awful lot. And it talks about a lot of the things that we've mentioned here. And it has interesting studies in it. This is a professor, I think Stanford, like I said, and he did studies with his students, things like doing the all-nighter before a test and, you know, testing them before and after and how much sleep they lost and how well they did on some of these things. There were some really interesting studies in there about sleep deprivation. It makes you want to get better sleep.
For sure.
Who is the initial point of contact in the medical profession when insomnia is encountered? Your general practitioner or psychologist?
I would say your family doctor. Start with your family doctor.
Do you have any input on why some encounter sleep paralysis?
I don't have any answer for that.
No, I mean, sleep paralysis. When you do go to sleep, especially when you go into REM sleep, your body does lose a lot of its, you know, kind of motor control. Most of your muscles, all of your voluntary muscles, they do go into a state of paralysis where you can't move. And that's really a defense mechanism for your body, so you can't harm yourself or harm anybody around you while you're, you know, maybe swinging a baseball bat during a dream. You don't want to be swinging around in bed like that. Now, unfortunately, some people do have REM behavior disorders where they can act out their dreams. But in other cases, when that person wakes up from that REM and they're in that paralysis mode, for some reason that motor function doesn't get initiated right away when they wake up, and they're still unable to move for a short period of time. It can be quite scary for people, you know, to wake up and not be able to move right away. So,
Does asthma medicine help with the throat closing of sleep apnea?
No.
Do I need a referral from a family doctor to get a sleep study?
I know that I can do a sleep study, you know, without them having to go through their family doctor. I can order a sleep study. The pulmonologists are sort of the official sleep disorder doctors. And I don't know if the family doctors now can directly order them. That, yeah,
Yep.
It didn't used to be that they could, but
Yep.
I'm thinking they can now.
Family doctors, ear, nose, and throat specialists, cardiologists can order sleep studies. But I mean, if you think maybe you have sleep apnea, but you don't have a cardiologist or an ear, nose, and throat, I mean, a good place to start a lot of times is just that family physician.
What are the safest methods to stay awake on a long road trip when sleepy?
You know, I read a whole big study about that, and maybe Nate will have other ideas, but there's a lot of things that people try. Smoking cigarettes, eating, you know, and talking on the phone. But when they've done the studies, there are some roads, it's interesting, in the desert Southwest that have rumble bars kind of continuously on the road. People will stay awake better on those roads, but then as soon as they get, so like for 100 miles, but then when they get on the smooth road, they're more likely to fall asleep. So they've done some studies like that. But the two things that for sure will help with sleep apnea, one is caffeine and one is stop and take a nap. And that seems like, oh, I'm in a rush to get to Omaha. But if you feel like you're falling asleep, to stop, just pull over in some drive somewhere, lean your seat back, and even sleep for 10 or 15 minutes. You can kind of get over that little hump and then keep driving. But those are the two things, along with the rumble bars for hundreds of miles. And there aren't many roads with that, but those have been shown to definitely help you stay awake. All of those other things, I've heard so many different ideas that different patients have, and perhaps for one person, eating candy is the thing that will keep them awake, or talking on the phone, or some things like that. But statistically, you can't count on that. So you might have some other.
I don't have a lot of great tips for doing it. I mean, I've done it before. I drove from Las Vegas to Columbus, Nebraska nonstop one time. It wasn't my smartest idea, but you know, a lot of people think rolling down all their windows and that airflow is going to help, but actually that wind and that air blowing in your face actually makes you more tired. Everybody's heard the term wind tired before. It's really what you're doing. Yeah, I guess sunflower seeds, you know, it's something that kind of just keeps you busy. But like I said, then the whole time you're reaching down looking for sunflower seeds, your eyes not on the road. At some point, you just have to stop. I mean, to be honest.
What is your opinion on taking naps during the daytime? If you feel tired enough to fall asleep and take a nap, is it best to avoid taking a nap due to it interrupting your normal sleep schedule?
Well, you know, really the perfect sleep schedule is just to take a nap or sleep whenever you're tired and then get up whenever you get up. But you can't do that. You can't live your life doing that. So especially someone that's having trouble with insomnia, I would discourage them from taking naps. You know, if you have to stay up late and get very short sleep during the night, then maybe the nap is the thing that evens that out. So I think you can kind of add up the total hours of sleep you get over a 24-hour period. And so the nap can be okay, but don't expect to take a nap and then be able to get to sleep at 10 o'clock at night and sleep 7 hours. That, you know, if you took a 2-hour nap, you're not going to be able to fall asleep that as easily. So you have to factor that into your total sleep time. So in general, I kind of discourage naps just because then you can't get to sleep as well at night. But, you know, I understand if you only can sleep, your kids are up all night or just whatever, sometimes a nap might be the right thing to do.
Yeah, it's usually a good idea to try to limit that nap time to, you know, 45 minutes to an hour, something like that. The longer you're in that nap, especially if you have something you got to get done that day, the longer you're in that nap, the deeper and deeper you're going to get into that sleep, and the harder and harder it's going to be able to get yourself up and going, you know, to get your stuff done. Napping is not a bad thing. You know, your body has its own rhythm. It's called the circadian rhythm. It's your body's own clock. And, you know, studies have shown about 2 o'clock in the afternoon to 4 o'clock in the afternoon, your body does start doing some things that make you want to take a nap. Your blood pressure drops a little bit. Your body temperature drops just a little bit.
And that may be where this whole idea of the siesta came from, because there are some cultures around the world that do the siesta and they close all the stores from 2 to 4 o'clock. And then they open their stores and there might be open till midnight, but people go home and take naps. And they're, just like Nate said, can be sort of a natural thing to do.
What foods or drinks are best for becoming sleepy at the desired time?
I think things like chamomile tea are okay. You don't want to drink an awful lot of liquids before you go to bed, because then you have to get up in the night to go to the bathroom. I would discourage a lot of sugar, like that piece of cake late at night is a bad idea, or ice cream. I usually discourage people from eating very much right before bedtime anyway, because we see so many people with reflux that it aggravates reflux to sleep on a full stomach. So I kind of encourage them to eat earlier and not fill their stomach up right before they go to bed. But if you were going to have to eat, I would say something like chamomile tea. There's a lot of different teas that are natural and non-caffeine.
Peppermint. I heard peppermint teas.
Right.
Hear that one a lot. Yeah. If you actually wanted to eat food, keep it to something very simple, something that your body can digest very easily. You know, nothing too complex. You know, fruits, vegetables, stuff like
Well,
that.
I
Just a little
have
snack.
switched myself from ice cream to an apple.
Yeah.
And that's been good. That sugar late at night, I'm convinced that'll keep me awake.
One more. Is there a connection between sleep apnea and migraines?
Well, headaches are certainly worse in people with sleep apnea.
Yeah.
And depends on your theory about headaches, because there's an awful lot of thinking about that. And some headache specialists would say that all headaches are kind of on a migraine spectrum, from the smallest little muscle tension headache all the way to the very worst migraine, that it's on this whole spectrum. And being sleep deprived will aggravate almost any of those headaches.
Yeah, pretty much hit it on the head with that one. Headaches is a pretty common symptom we see for people coming in for sleep studies, things like that.
And when I see patients just for headaches, I'll tell them lack of caffeine. If you're used to drinking that coffee or Mountain Dew all day and you've cut that out, that's a side effect of it's caffeine withdrawal, and then lack of sleep. Those are kind of two of the big ones for cause of headaches.
Well, that's all of our questions, so that will do it for our seminar today. Thank you guys all for joining us, and we'll see you guys next time. Thank you, guys.
Thanks.
Thank you.